My name is Rebekah Melendrez. This is case study number 1 for SPC 683 with Dr. Weekly at Ball State University. My client's information that I will be using for all of my case studies is a 9-year-old male who is a Gestalt language processor, which means that he is minimally verbal, speaks in scripts, uses an AAC device when speaking of his feelings, utilizing the zones of regulation curriculum. So he uses this device to be able to tell us why he's in the red zone and what he needs to get him back to the green zone. At the age of 6, he was diagnosed with autism spectrum disorder at a level 3 intensity. He was also diagnosed with developmental delays of mixed type and developmental language disorder. Some additional behaviors of concern are noncompliance, ADHD behaviors, trouble tolerating change, and perseveration. These are some of the assessments that were utilized in a public school setting. Please note that I am school-based and not clinic-based. So the first one is the Behavior Assessment System for Children. So the Basics 3 is a norm reference rating scale designed to help identify a variety of emotional and behavioral disorders of children. And this is gathered from all stakeholders, including parents, teachers, and the child. The Vineland Adaptive Behavior Scale refers to the individual's typical performance, the day-to-day activities required for personal and social sufficiency. This focuses on what the child does rather than what he or she are unable to do. What the student actually does rather than what he or she is able to do. The receptive one-word picture vocabulary tests the receptive vocabulary at the single word level. So in example, it would be saying, I'm going to say a word and show you some pictures, and I want you to point which picture matches the word. The assessment that was used is a functional behavior assessment. So the first step of this was a needs identification interview with all stakeholders. An antecedent consequence behavior observation took place. We used that information to gather together a scatter plot observation. From there, data triangulation chart was filled out, and then up next, the behavior assessment was occurred, and then from there, we set up a behavior intervention plan. So the behavior of concern for this FBA was elopement. So the operational definition of elopement was that any time or instance that B leaves his assigned area without permission to access desired tangibles. So an example of an elopement behavior is when B runs to sensory area of the classroom to get a tangible he desires without asking for permission or earning the tangible. A non-example of this is when B asks for permission to get up to get the tangible and is granted the permission. The intervention that we put in place was a token board. So B had to earn 5 tokens before he could earn whatever his choice tangible was. So by earning to earn tokens, he had to sit, he had to remain quiet with a calm body and work. So the second one of these 4 replacement behaviors were not utilized. He did not earn that token. So when he eloped, he was not sitting, so he didn't earn it. When he was not quiet, when he would yell at us or be upset about something, when he was not having a calm body, and when he was not working. So the results of this assessment was that through the FBA, it was clear that the function of the eloping behavior was to gain access to tangibles that he had not yet earned or had been denied access to previously. So in our graph here, you can see that his baseline range went everywhere from 22 to 42. And once the intervention was set in place, due to the FBA assessment, we got his baseline or his average down between 11 and 16. So some BCBA task list items that we worked through with B was providing examples of positive and negative reinforcement contingencies. We were able to find out his motivation, so his motivating operant. We were able to establish operational definitions of the behavior so that anyone that came into my classroom, whether it be admin or the staff that works with me, was able to know what we were tracking and what that behavior looked like. Conduct assessments of relevant skills, strengths, and deficits. So this was everything that was ran on B beforehand. F6 was escape and avoidance to obtain tangibles. We realized that was the function of his behavior, so we went about how to manage that. G1, positive and negative reinforcement procedures to strengthen behavior. So for him, that just looked like a lot of positive reinforcement every couple minutes. Through this, we were also able to work on G5, modeling and imitation modeling. So showing him what that looked like and what a pro-social way to earn tangibles were. G7 shaping, G4 reinforcement procedures to weaken behavior. So a lot of it was we would reinforce the positive things we wanted to see, such as him sitting, such as him asking for permission to gain tangibles. And of course, through that, as I showcased, was the token economy. So B had to earn his tokens before he was able to earn his reinforcement. And we knew that the reinforcement meant enough to him if he was able to learn those replacement behaviors, such as sitting, working, calm body, being quiet. And through all of this, we were able to curve the behavior of eloping, and it was all done through BACB task list items.